You never know when you're going to need a doctor. You never know when something's going to happen. And when something happens, it's a lot different to go in urgent care or ER when nobody knows you and they're just kind of, this is what we're doing. And like, we don't care what you have to say about it. We know our patients and we can kind of individualize what we would do for them based on we know what their wishes are and how they live life and what's important to them.
All right, so guys, this episode of the Pollinator Podcast, Married in Business, we are interviewing our own medical doctors, Dr. Morrissey and Dr. Gerace with Highlands Direct Primary Care. So thank you guys so much for being on our podcast. So I'm going to give it to you, share a little bit about your practice.
Thank you guys so much for having us. We're thrilled to be here. So we founded Highlands Direct Primary Care in kind of the latter half of 2023. So we're about a year and a half old now. We were inspired to do it because as both internal medicine trained clinicians, we saw a big need for more access to quality primary care. It was a big leap, but we're so happy that we did it.
We're a direct primary care practice. So that's relatively new. It's been going on for some time around the country, but it's a newer type of model. It's a membership-based model within the monthly fee and covers unlimited office visits, telehealth. We have wholesale pricing on labs and imaging. We have over 1,000 medications for free included. But kind of what really inspired us to do this as opposed to signing on with some guaranteed salary, we saw that there was no price transparency in healthcare, and that it was very expensive for basic testing, basic medications, imaging. And we would see, in our training, a lot of patients that would go into the ER, and it was stuff that easily could have been handled in their primary, but there was a 6-month wait to get in. And even with primary care as it currently, the fee-for-service model, the insurance-based model, because there's so many middlemen and middlemen layers to healthcare, that's why the prices are so high. And that's a big, reason we started our practice is we can offer price transparency. It's direct access to me and my wife. There's only one other worker right now, and it's my father. So it's a family-owned business. Keeps it real tight. Yeah, exactly. My dad's kind of our best marketer / jack of all trades, really. We also work with a lot of small businesses. And so we have discounted pricing for small businesses. We know that obviously the cost of health insurance and healthcare in general for a company is kind of like oftentimes the biggest line item expense in their budget. It never really goes down year to year. Even if you have incredibly healthy staff, it always kind of goes up 15-20%. And direct primary care is kind of in the future, I think, going to be the centerpiece of a lot of healthcare plans. And they're going to build the insurance plans around this type of model because we're going to have so many savings for these companies with our wholesale lab pricing, the medications, reducing the copays and all that kind of stuff. And then trying to prevent unnecessary ER visits, specialists, urgent care visits, which are huge expenses for companies and insurance, whereas we can handle a lot of that.
And that's why, when I met your dad, I remember because I was in the healthcare space for 15 years. And I knew some doctors who their spouses were also doctors and did direct care, but they called it concierge care. And it was very expensive. It was you charge us one big price up front and you have unlimited access. So it still seemed very inaccessible. So when I met your dad and he told me about this, as someone who had recently gotten out of the corporate world, we didn't have that health insurance plan anymore, that we never met our deductible. We barely ever used anyways. So when this option came up and I reached out, it just made so much more sense that, yes, we have the basic catastrophic for if God forbid we ever have to be hospitalized, but having access to routine preventive care and, urgent care and all stuff through you guys it just made so much sense. And yeah, it's been great that I can call or text and I get a response right away. It's not like I'm having to sit in a waiting room with 30 other people for a 2-hour wait time. That never had to happen with you guys.
It's kind of weird. We just had a patient before this call, or a prospective patient she's a mom of her daughter who lives in Winter Park. They live in South Florida. And she called and I answered the phone and she's like, wait, this is the doctor? I'm like, yeah, this is Dr. Morrissey. That's me. And I'm sitting right next to my wife. Let us know how we can help. And she's just so confused that it's that direct.
Right.
Which it may not always be like that, right? But if it continues to grow, but maybe just one level removed.
Yeah, my dad, or if we have another assistant.
Yeah. but it's more fun for us to be that involved. In a larger practice, there's more staff, there's more office staff, there's medical assistants for taking the vitals, drawing the blood, and things like that. But I was just thinking with a patient earlier today, actually, that even though it's a little bit of kind of added tasks for us to do it all ourselves, I kind of like that because it's more points of contact between us and the patient. So it's just enhances that relationship. And the relationship side of things is what we love so much about primary care, specifically about this direct model. Being able to spend more time with our patients, get to know them, and then communicate directly with them, even outside of the office. So yeah, we won't want that part to go away.
And there's an old proverb in the Bible that says, everything that is new or everything that was old is new again, or basically how there is nothing new under the sun. And so even Dylan, when you're talking about it being kind of this new thing, I'm like, but is it really new? Because isn't this what your neighborhood doctor used to be in the community? Like they did know everybody, and you came in and you just saw the doctor. Maybe they had a nurse or something. I mean, even in my community growing up, I mean, that was pretty much the way it is. Dr. Johnson practiced, he was like 90 years old. The price transparency is such a big thing. And I don't want to go and talk. We don't need to talk too much about all the ailments of the American medical.
That's a whole different podcast right there.
But I find it interesting that it is coming back to so many things are coming back to local and community and being able to have those kinds of relationships. It used to be this thing, but now it is this differentiating opportunity in business that people are wanting to go to because we move so far away from that.
Yeah, exactly. I mean, like especially in medical, like primary care specifically, it's like you never know when you're going to need a doctor. You never know when something's going to happen. And if you don't already kind of have a relationship with your primary, obviously your wishes are different than Shannon's, are different than mine, are different than everybody's is unique. And so how we would approach care has to be unique to each person. And when something happens, it's a lot different to go to urgent care or ER when nobody knows you and they're just kind of, this is what we're doing. And like, we don't care what you have to say about it. We know our patients and we can kind of individualize what we would do for them based on we know what their wishes are and how they live life and what's important to them.
Yeah.
Well, and I can tell you just my own personal anecdote. There's been times that Shannon's been like, do you want me to call Dr. Morrissey about this, or can we ask about that? And I'll be like, yeah, that's fine. Go ahead. Where other times she's been like, I think you need to go to urgent care. And I'm like, no, I don't. And
this is before we were working with you guys.
One thing that was kind of innocuous, like I sliced my finger doing something, and she's like, oh, you need to go get stitches. And I'm like, no, I don't. But I went and I got 2 stitches, right? Maybe it was 3. And but he basically just wrapped it up in tape, and it's just like, all right, leave this in here. And there was like the coolest thing about the whole thing was some fancy bandage applicator that was like a tube or whatever. I'm like, all right, that was kind of neat to see. But then at the end, they charged, I can't remember, it was ridiculous. It was like $250 or something to come in. And the guy's like, all right, well, come back in. And I'm like, you're going to charge me $250 again just to come in? He's like, no, it's not. No, you don't have to do that to come back in. And he didn't even know how his own system worked, because the billing assistant is like sitting right there in front of him, and she just like looks up at him. He's like, yeah, he does. And it's just like such an utter disconnect from like what he wants to do to be able to take care of the patient versus how this whole system is set up.
Obviously, that's a whole nother conversation. But the reason I really wanted to talk with you guys is because we've been speaking with other business owners who are also married. And you guys are the first married couple that I have met so far that actually started the business before y'all got married. And I'm like, I was like, what was that like? And and also like, what did your families think? Like y'all are gonna try to start a business together? Like were they like, oh cool, or were they like, y'all are nuts?
I don't know if we got anybody saying y'all are nuts, which is good. But I would love to ask, my parents what they thought of it. It was, I think, the biggest thing that was a big question mark for kind of everybody involved, ourselves included, was the fact that we were doing something that is kind of an alternative approach. So typically, when you finish residency, you sign on in an employed position, either with the hospital system or another clinic. And it's kind of that you get that sign-on bonus, you get that guaranteed salary, and that's the road that's paved ahead of you. And we were kind of going off into the woods in a way. And so I think that was the scariest part for us and for the people who care about our success. But it wasn't as much, us doing it together. I think that because our families have seen us together for, quite a few years now, there wasn't a question of whether we could do it together. It was more just such an out of the box move,
So for context, and maybe Shannon knows more than I do. So y'all were engaged before when it got started, and y'all had been together as a couple for a long time. You just not walk down the aisle.
So we had been engaged since January 2023.
It was like late December 2022. Yeah. And then we started the business summer of 2023. And then we got married September 2024.
Yeah.
Oh,
so, how long were y'all dating before?
6. Well,
5 and change, right?
Yeah.
5 years and change. So it's a funny story because we both went to UF for college, and then we both went to UF for med school. And in UF, we were the same major, the same classes, both pre-med. We were living probably 1 or 2 buildings apart, same bus route. Probably were on the same bus, the same classes for 4 years, never met, never knew each other. And then med school came, and it was like one of the first couple of weeks of med school where we met in the library. So we've been together for some time, but it was like we probably passed each other even 4 years before that.
Oh, wow.
Yeah, like walking down Hume or...
Yeah, we're both daters as well. We actually met in college. So how did you guys decide, what was that conversation like to okay, you know what? We're going to veer off the typical track and we're going to do this new thing. And hey, let's do this together.
Okay. It had been kind of evolving for a little while before it really took off. So when we both decided we wanted to do primary care, we were both kind of dissatisfied with the options in front of us in the insurance model, because you have, as a physician, so little time to spend with your patients that you end up having to refer out for everything. And there were so many issues. So we were looking at, maybe the VA, because they have 30 to 60-minute time slots. They don't have to worry about insurance. And so it was just kind of a better working environment as a physician. I had learned about, direct pay models like concierge medicine. And I liked that element of the direct access to the physician and more time with the patients. But I didn't like that it was more expensive and kind of limits access. And so I was struggling to find that kind of perfect balance of what I was looking for. And then we came across direct primary care. Do you want to talk about how you came across it?
Yeah. When I was in my training, it was like an overnight shift. And I don't think even some of my resident friends even really know this story, but it was a night shift during my intern year. And I started just getting weird chest pain. And then eventually I started getting pale and really profusely sweating. And then my senior resident literally carried me downstairs to the ER. And by that point, I was full on shaking, sweating, pale, nauseous. And I was I didn't know what was going on. I was having really bad chest pain. I was I didn't think it was likely that I was having a heart attack. As, a young guy in my 20s, I just played hockey earlier that day. I'm pretty fit, never get this kind of pain. And of course, I talked to some people in the ER, some of my resident friends, and they put an EKG on me. And I was full going crazy in the ER. They were able to do the EKG. I wasn't having a very obvious heart attack. It's just so unlikely that I'm having a heart attack right now that they still wanted to admit me and run a bunch of labs. And I was just so scared of how much that was going to cost me, even though I work at the hospital and I'm on shift right then. And that's my friends that are be taking care of me. And I have insurance through that hospital, and I still don't know how much it's going to cost. So that was kind of that was the first step where I'm okay, there must be some alternative model. And then a couple of years went by, and I was interviewing for different jobs at the big hospital systems, private practice, everything, and still looking for alternative models. And we had at that point heard about direct primary care, and we thought that's a fantastic solution. But is it the right time? We're so young. We're not even married, like you guys mentioned. One thing that stuck out was I was interviewing with one of the hospital systems in town with a recruiter, and they were talking about working hours, how many patients, all the details. And the one thing that stuck out to me was I asked, well, where is the clinic? Like, where would I be working? And they said, well, it can be wherever you want. Like, we don't have an exact space for you, but if we hire you, we'll put it wherever you want. It could be Ophedo, Winter Springs, Winter Park. You tell us. And I was like, they basically said, you can put it wherever you want. I was like, that's just such a good idea. I'm going to do that. And so I was like, that's the best idea you guys have given me. And I really wanted to do direct primary care. And we were kicking around the tires. And then we decided, like, we're both doctors, and it works out because I can handle a lot of the men's health. She can handle all of our women's health, which is kind of a nice balance for us. And then I think there was some moments for us, like, we're not married. How are we going to co-own the business? Am I going to own it? Is she going to own it? And then are we going to, when we get married, try to work out, how we're going to do it then? But we just said, let's just start because we're not getting any younger, and patients need us, and what better time than now? And so then we started it in residency. That took some good grace from our program director and stuff like that. But we just said, let's just do this now. Like, quit kicking around the tires, quit wasting time, and the rest is history since that.
Mm-hmm.
So when did you finish residency?
Just this year, or no, last year now, in July or June.
So you got finished residency, got married, finished residency, opened practice, got married.
We opened the practice first, then finished residency, then got married. And this summer was
overachievers. Gee.
It was a long summer.
2024 was a rough summer.
It was a long summer because it was like trying to plan a wedding overseas and then building the practice and finishing residency. That was probably our most stressful time as a couple, I would say.
Mm-hmm. Yeah.
Were y'all doing residency in Tampa at UCF? Or
no, here.
Here at Florida Health.
Yeah.
Mm-hmm.
Oh my gosh.
Yeah.
It was quite the beast to take on, but the way we reasoned through it at the time, I mean, it was multiple factors. If we had taken the more conservative approach, the safer approach, if you will, and signed on to a job straight out of residency and then kind of built the practice on the side with the money that we would get from having a real job, there was pros to that, but also the cons of, potential non-competes at the time. There was the fact that, if we were working full time at another practice, we would not be able to dedicate everything we would need to starting the business. And, multiple other things. Plus, we are, as eternal students and residents, we're used to being kind of broke. And so we're like, let's just do this, startup phase now, stay broke for a little longer than we planned, and then grow from there, rather than, getting used to that more cushion salad structure, getting the golden handcuffs and then trying to pivot later on.
Yeah.
Like, let's just dive in head first now and do it. And there's been lots of challenges, but I'm so glad that we did it that way. Because all the reasons that we did this have stayed true.
So we're reading this book right now that one of our coaches recommended called Rocket Fuel. I don't know if you guys have read this, but it's like visionaries and integrators, and every business typically has somebody that tends to be more of the visionary and more of the integrator. And Will's a visionary. I
was going to ask about you guys.
He is clearly he is the visionary. I am the integrator. But like, you both are doctors, which you have the same training. Which is which, or is there neither? Are you both this, like, what would you say?
I think we're both a little bit of both. Dylan has definitely taken the lead with on the business side of things. Okay. And I do a lot of like the social media marketing, our website, all of our digital marketing. I created our logo, our physical, like our business cards and brochures and things like that. I call myself the chief design officer.
Yeah.
So that's been kind of my strength in on the business side of things. And then of course we're both seeing patients, and so we're both equally, the physicians of the practice. And so I think on the logistics side, Dylan has definitely taken the lead. And then on the marketing side, I have taken the lead.
Being a doctor is one thing. We spend a lot of time training for that. And I wouldn't say that's easy, but in terms of that versus starting a new business, that was the easier part at the beginning. And then kind of being a business owner is kind of as you guys probably know, it's just entirely separate role or separate thought process. And so I put a lot of time into reading books, listening to podcasts, kind of really thinking about how do I grow my practice? Because I know people need what we offer, and there's a huge need for it. But how do I let people know that we're out there, what we do? Mm-hmm. She also has a leadership role in being a visionary as well, because there is a time over the summer, part of that long, arduous summer, trying to do too many things at one time, where I was exhausted, didn't sleep well. And there was a point where I was like, man, like questioning, like, is this going to work? Is this the right path for us? Can we make this work? And, I was telling her this, and she was like, no, like, you're not giving up. We're not giving up. Like, we can do this. We just need to keep the path, keep doing what we're doing, keep growing, keep getting better. Just keep taking care of our patients, do a really good job at that. And then the word will spread. And I mean, honestly, that was probably the pivotal moment for us, because after that, like, she kind of inspired me to stop having a pity party and kind of try to figure out ways to grow and let people know we're out there. And ever since then, we've been growing like crazy. So I think we kind of share both roles. I think it really, it's honestly a perfect partnership with what we do.
That's so awesome to hear. And having, other people that we follow, especially for business, one of the biggest indicators of if you're going to be successful in business is the quality of your marriage. And certainly there are people out there who have been successful in business and it wasn't necessarily related, but you never really saw the other side or how supportive or things were on the back end. But everything that we've seen in the other couples that we've had conversations with that are in the business together, everybody seems to come back to that, and the business is ultimately secondary to that relationship, and it's really the value of having a solid relationship with each other that then supports in all those other things. Because like you're saying, there's always those times of self-doubt and everything else and it's so much different than if you'd have just gotten jobs. You'd still have to be there and listen to each other and support, because it'd be things you can be complaining about there, but it's not as existential to your survival.
Yeah. And honestly, I think Will's been doing this for 14, 15 years, whereas it'll be 3 years in the summer that I left my corporate job and joined. So I still feel like a baby, even though I've learned a lot. I feel like I've grown a lot. I've come a long way, but there's still so much that I'm learning. And there's still, I don't know that there's times where I'm like, what are we doing? But there's still moments where there's these ebbs and flows. And what I've noticed, there's a pattern, is every time you're at that limit where you need to grow to the next level, there's going to be this tension or this resistance where you feel like you're hitting a wall. And before, when this would happen, because I hadn't experienced it before, I would freak out. Full on panic, oh my God, we're going to lose everything. We're going to live in a car. We're going to be homeless. We're going to be destitute. It would just, but now that it's happened a few times, I'm like, oh, we're just ready to move to the next level. Okay. What do we need to overcome? What do we need? What are we supposed to learn? What's the next step? And so now I recognize it as an indicator of oh, we're ready for the next level, rather than, oh my God, we're dying.
That's good of her to say, though, because I still ask, do we know, what are we doing right now?
That's honestly, I would say that's exactly how it came. Like when I was talking about this summer thing, that's exactly what happened. It's like it was just time where you had to kind of overcome. You got to get over the hump, and then like everything kind of got a lot better, like really fast after that.
But don't question that comes again. That's what I'm saying. It's like every time you're about to go to the next level, it's going to come back around. And like the sooner you can recognize it and push through it and like overcome it, the better off you'll be.
Wow, that's good tip.
That's really right.
Can I ask a question for you guys?
Yeah.
So something we've been trying to figure out, and you guys have more experience than us now. How do you kind of put a limit on like how do you separate the business from the marriage? And like, do you say like, hey, there's a day of the week where we just don't talk about it? Because like we're both doctors, we both do the same thing. Even if we were not in business together, we'd probably still talk about whatever patients or whatever's going on. Well, for us, it's like we're blurring the lines a lot, and we're trying to think of how we can separate our business from our personal life.
You can't.
I mean, we've talked to some people that say they do, but we haven't been. Out. So like,
well, but even the couples that we've talked to, like they're always like, well, we try, but no one. It doesn't seem like anybody's got it clearly figured out. Because here's the thing: it's like if it's something that you enjoy doing, and you're always doing it together, like I think it's like, do you like why do you have to not talk about it? Is it because we're told that, oh, you have to keep these things separate? Like we're trying to like fit into some like pre-structured, mindset that's been put on us versus like if you don't, as long as it's not having a negative impact on your marriage, like if you're having a date night and you're enjoying the time together and you happen to be talking about business, but you're enjoying talking about it, I'll see a problem. It's now if it's one person's like, hey, listen, I don't want to be talking about the business right now. Like I feel disconnected from you personally. I really want to have more intentional time that we're focusing on us. Then, okay, then it's an issue. Then like, okay, yes, you need to carve that out. But if you both don't feel like it's an issue and you're both still feel like you're connected and you're enjoying your time together, even if you're talking about business, I don't think it's a problem.
Yeah. Good point.
That's my opinion.
It sounds like once in a while we just need to kind of turn our phone off and go to the beach and just.
Yeah, I was literally going to say something like that.
I mean,
like we have our place up on our family farm, and we'll get it too, for us with kids, like we find that it is important and to about once a quarter or so, like go leave the kids with the grandparents for like an extended weekend and go off. And like even like last year we celebrated 20 years and we
yes, sorry.
Was it?
No, you do, because now we're in 2025. So 2 years ago. 2 years ago.
Yeah, so in May 2 years ago.
Yeah.
We celebrated 20 years, so we booked a cruise. Mm-hmm. But we planned time in that cruise that we knew we were going to be talking. We still took some client meetings, but it was a very truncated schedule. Yeah. But there was other times that we said like, look, we're not going to have a better opportunity to be away from everything. And I mean, ultimately, what is this marriage? In any kind of context, like marriage is supposed to be a partnership, and you're doing life together, right? And like we're working towards some kind of goal or some outcome, or we've got a life in the future that we want, and we're building that together. Well, an integral part of that is us building this this business together. And even looking back in the older days or 60 years ago or whatnot, when things were more one income households, like it was still like this partnership. And it just so happened that one person was the breadwinner, but if you didn't have that kind of partnership and you were working on things together, like it was going to fall apart. I think it is mostly about keeping that future and keeping your core values and those things in line. And like, not even why are we doing this business together, but why are we together? What are we trying to to accomplish together, and that life we're building. And then the business is a vehicle for that, and hopefully an expression of what we're good at and how we can add value to other people and to the community and everything else. And if all those things are still working in alignment, then you're good.
Yeah, that's a really good point.
And part of it is just taking it day by day and winging it at a certain point.
Yeah.
Learn as we go.
I think the phrase that I'm constantly trying to remind myself is like progress, not perfection. Because I tend to be an overthinker, and that's just something I've really like working and evaluating and working through over the last year of like just what's that one step? What's that one little thing that can, move forward? And if it doesn't work out, then I can just do something different. It doesn't mean that it's a failure or, oh my gosh, all businesses is just constantly just trying and figuring out what works and what doesn't work and pivoting and just constantly tweaking and adjusting. And
it's like, putting out all these little fires while at the same time trying to go work on some system to prevent the fires in the first place. And at some point, like the limiting factor is not going to be necessarily the business or operations inside the business or marketing for that. Like it may be things are going like maybe you are worn out, and the good thing about having a partner that you intimately trust, at least that I found, is you can trust their perspective on it, or at least that would be the ideal. And maybe more so. I mean, I didn't have a huge team before Shannon come on. We've grown exponentially before there, but like sometimes it's hard to trust an outside perspective in that if they haven't been down the same thing or they're not in it with you. And so that was, it took a while to get her to come and like quit her job. But she's also, I'm much less risk averse than she is.
Oh yeah, okay. Anyways, I'm the one who basically overthinks, like thinks about every possible thing that could go wrong. Like that is me. And so him wanting me, he was like years and years was wanting me to come join him. And I was like, you're nuts. Like we'll murder each other. Like it won't work. Like we'll get a divorce because we both have very strong opinions. We can both be stubborn, and I didn't fully understand. And honestly, I didn't fully understand what he did. Because I was a dietitian, like I was working in a hospital and then I was working medical sales. Like I had this world. I was like, this is like, what would I even do? Even when I did first join, it probably took like 6 months to even figure out like, what is my role in this? So I think, at least for the two of you, you both knew like, okay, it's a medical practice. Like we're going to be doctors. But at some point, like you said, you'd have to figure out like, okay, but there's more to write. Like it's not just running a business is not just getting to see patients. There's all this behind the scenes stuff that happens too. So figuring out those roles, is a process as well. But it sounds like you guys kind of naturally kind of picked up on your natural strengths.
Seeing as y'all are still newlyweds in this and newlyweds in the business, what would you say has been your biggest observations like so far that you would tell somebody else that if they were in kind of a similar situation?
I would say a philosophy or motto that I live by is whether you believe you can or you can't, you are right. So if you want to start your own business, if you want to start a medical practice, whatever it is really that you want to do, if you think you can do it, you can. Now you have to kind of be prepared to run a business, and especially if you're going to do it with your partner, you have to find ways that you can complement each other, have kind of roles that interlap, and also you have strengths and weaknesses and kind of utilize them appropriately. But I think you kind of have to be understanding that, like, even if you are the best doctor or lawyer or whatever it is, salesman, whatever it is that you do in the entire world, if nobody knows you exist, it doesn't matter. So I think, figuring out a way that you're going to let people know is probably, if you're not willing to do that, if you're not willing to kind of put yourself out there a little bit, it's going to be hard to start a business and to grow a business.
You have to be comfortable with being uncomfortable. And I think specifically in the context of a couple that are going into business together, I think that it's really important to just always remember that the other person is your like life partner, not just your business partner, and treat them accordingly, because it can be easy to get into work mode and, you know, in a given situation, one person kind of has the upper hand because your area of expertise in the business, and they can kind of go into boss mode and giving orders, and that is not always good for like a romantic partnership. And so just always remembering that this is my wife, my husband, and not losing sight of that in all of the, you know, running the day-to-day of running the business.
They still don't really teach business classes in med school, right?
Not at all.
No.
Not at all.
Are there even any classes on just like how to run a private practice?
Nothing. So my understanding, you know, I have a really good friend that his dad and wife, they have been running their own practice for 30 years now or something. I don't want to age him, so I'm not even going to say, but it was over 30 years ago that at the end of residency, I guess the last year was like almost entirely of how to start your own practice and how you're going to do the operations, how you're going to grow and take care of your patients and all the ins and outs of that. And now we get zero of that. And it's almost like, wow. This is just my personal opinion. I think other doctors' opinions too, is like, we're purposely not taught that because you don't want doctors to compete with you if you're the big hospital system or the insurance companies or whatever. I think we're intentionally shielded from a lot of that.
Just be experts in a very narrow cogs and be an employee. Yeah, in the big machine.
Reliant on somebody else to like give us a payroll because we can't do it on our own. And so most people who are in medicine, who we told we were doing this back when we were starting it, they looked at us like we were crazy. I would say that the fellow physicians were the ones who looked at us like we were crazy more than anybody else. And there is this learned helplessness when it comes to business, you know, because we are not taught that. We're taught a lot of other things, but this is a whole new, you know, area. So we've had to teach ourselves a lot.
What has been your path for learning?
Yeah.
Or like how to just run like a business in general?
Well, I think Dylan and I can comment on different sides of that. So for me, with the marketing side of things, it has been a lot of just learning by doing. I haven't really done any kind of online courses or anything like that, but just kind of practice and
yeah. And I mean, I'd say a big part of it. So I had kind of started some businesses in high school and college, just like stuff with my friends. Like literally we made like, I don't know, 300 flyers and put them out in every house in the neighborhood we do anything. That was basically our business is we'll do whatever you want as long as you pay us $10 an hour. And,
like odd jobs.
Odd jobs.
Handyman odd jobs.
Not anything. I had done that. I had done, started another, like, we sold a bunch of fidget spinners, me and my friends in college. So we started a little incorporation there. And so that was part of it. Like, I kind of had some experience, but then really throughout this process, it was really like just putting one foot in front of the other and learning by doing. Like she said, is just, if Michael Jordan read every book about how to shoot a basketball, but never shot a basketball, he'd never be good. You have to at some point shoot the basketball. That was part of it. I knew I just needed to start, because if I started with anything in business or anything in life, really, then when you actually consume information that is going to educate you, you actually can put it into some sort of context. And then that helps you learn a lot faster. And that's the same thing with learning anything. And so I think starting is the first step. And then I've been listening to podcasts, audiobooks.
Any in particular that you found like super helpful?
There was one book that I got recommended by another direct primary care doctor called Top Triggers. And it's about creating word of mouth marketing, which is super important, especially in healthcare field, because you're more likely to trust a doctor to go see a new doctor if it's coming from your friend or your family member. And so that's a big part of why we've been growing so fast now is because I think we've been open long enough and taking good care of our patients long enough that they feel comfortable saying, hey, you should go see this guy or this girl, and they're really good. And that kind of thinking about how to create word of mouth marketing in our practice is probably, that's, I'd say, one of the very helpful books that I've listened to and thought of how to do that in our practice.
Another big thing that we've learned along the way that has helped us towards success is always being willing to pivot when needed. And Dylan kind of had to coach me through this a little bit at first. For example, like changing our monthly pricing, kind of finding, what's the right monthly pricing for it to be accessible and affordable, but, also simple for people to understand. Like other things that have come up along the way, but having any kind of mental resistance to change will restrict your growth. And so being willing and able to just be like, all right, that's not working. We need to do something else. Even though I have 1,000 brochures printed with this pricing on it, we're starting over.
I think we understand, like.
Well, Shannon was after us to like rebrand for pretty much ever since she got on, and I laugh at that because I told her like, are we really on search? Like, yeah, we need to do that eventually, but like, I have all of this flip chart paper that's rebranded with the old brand, and I like
business card, all this stuff, and it's like, but it doesn't make sense. The name doesn't make sense with what we actually do.
Yeah, we got there. We got there eventually.
So yeah, we understand the pivot and having to come to like, hey, this isn't working. Like, we need to change.
I know you are busy doctors, and you've got patients to see. I really appreciate you taking the time.
Yes.
And kind of sharing some of your experience and being willing to have a conversation with us. I know it'll benefit other people that are out there.
Absolutely.
Yeah, for sure. Thanks for having us on. And, come see us come see us soon.
Yeah.
Very good.
All righty.
Guys.
Bye.